Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. If you guys want to learn more about the things that we talk about, you can check out our blog page, check out our YouTube page, and we also have an online class going about online dry needling in the autonomic nervous system. It doesn't teach you how to dry needle, but it teaches you how to think about dry needling in the proper way to regulate the autonomic nervous system, specifically by depressing the sympathetics and elevating the parasympathetics. Okay, so today I wanted to talk to you guys about dry needling and joint manipulation to treat and resolve hiccups, right? So hiccups are primarily from a spasm of the diaphragm, which is the muscle that sits right underneath our lungs, right? So the diaphragm contracts, it helps pull lungs into the air, or pull air into the lungs, right? So the diaphragm is innervated by the phrenic nerve. So the phrenic nerve is C3, 4, and 5. There's that old saying, C3, 4, and 5 keep you alive, right? Because that is because the diaphragm is innervated by those nerve roots. So C3, 4, and 5 in the neck, so somewhere about where my fingers are. The phrenic nerve comes out right in between the anterior and the middle scalene, and it has little branches that go right through the scalenes on its way down to the diaphragm and the other structures that it innervates, right? So remember, the cervical nerves come out above the segment, right? So C2, cervical nerve, comes out above C2, C3 comes out above C3. So C3, 4, and 5, so the C3 nerve root comes out above C3, so it comes out in between C2 and C3. That becomes important because C2, C1, 2, the spinal segment, is the most mobile segment of our spine. So if C1, 2 gets deviated, that's going to put a lot of stress on the phrenic nerves. It's going to make the phrenic nerve hypoxic. It's going to elevate sympathetic hyperactivity, and it's going to lead to hiccups. So hiccups are from spontaneous electrical activity of the phrenic nerve sending spontaneous action potentials down to the diaphragm and making the diaphragm contract, right? So Dr. Huberman on the Huberman Lab podcast, which is one of the best medical podcasts out there, you guys. I strongly recommend you check him out. He's a teacher in the medical school at Stanford University. He's a PhD. He's one of the smartest guys that I've listened to. He has really, really good scientific information to improve health in a natural way, kind of like what I try to do with my teaching. So Dr. Huberman, by the way, if you see this Dr. Huberman, bring me on your podcast. We could talk about this. I would love to do it. So Dr. Huberman recommended the best way to immediately or quickly resolve hiccups is a breathing technique. So breathing techniques are really, really awesome. And breathing is one of those things that a lot of people hear, like, oh, you're gonna breathe to help your health. Like, get the hell out of here with that witchcraft stuff. It's not true. Breathing is one of the best overall ways to regulate the autonomic nervous system. So again, in general, people suffer from sympathetic hyperactivity. That's just the common thing that people suffer from. Our nervous system responds to adversity, typically by elevating the sympathetics, right? So Dr. Huberman talks about a breathing technique where you take 3 inhales through your nose, so a big one, a second one, and then a third one, to maximally inhale your lungs. You hold it for about 20 or 30 seconds, and then you slowly exhale through your mouth. What that does is it contracts the diaphragm 3 consecutive times without letting it relax. That 3 consecutive contractions tires out the phrenic nerve, and it leads to temporary relaxation of that cycle where the phrenic nerve is becoming more negative. The diaphragm muscle cells are becoming more negative on their way to firing, and then you just get that spontaneous loop of the cells fire, they start to repolarize, they depolarize, they become more negative. Remember, skeletal muscle cells, so a normal healthy diaphragm muscle cell in general is resting at about negative 35 millivolts. To get to an action potential, the cell needs to get more negative to about negative 70 millivolts. With sympathetic hyperactivity, we get chronic body-wide inflammation, hypoxia. The cells become more acidic, cells become more negative, they become more likely to fire, right? So the overall reason typically for hiccups is sympathetic hyperactivity that's leading to a more negative muscle cell state in the diaphragm. Is leading to a smaller threshold for action potentials to go down the nerve, and it's causing spontaneous contraction of the diaphragm, which causes hiccups, right? So it's just like getting a cramp in your calf when you're sleeping. You're just basically getting a cramp in your diaphragm. So Dr. Huberman's method works really, really well to immediately and temporarily stop hiccups. However, it is not the best way to resolve hiccups if you're trying to permanently get rid of them. So this is the same reason why I believe that the way that most people use electrical stimulation with the patches and how they try to get the muscles jumping around, right? If you've ever had the eStim patches put on you, the way most people do it is they turn it up so your muscles are bouncing around. This works, however, it does not work long term because it's using the reverse of the nervous system effect that we should be going for long-term results. So sympathetic hyperactivity causes muscle spasms, it causes hiccups. Contracting muscles causes sympathetic elevation. By breathing in the method that Dr. Huberman showed, that works by turning on the part of the nervous system that is already the problem. So sympathetic hyperactivity causes hiccups. By causing 3 consecutive contractions of the diaphragm, you're elevating already hyper-elevated sympathetic hyperactivity. The reason it works is because that extra 3 consecutive contraction of the diaphragm tires it out to the point where it can't contract again for a little bit, right? Or where it's not going to spontaneously contract. The better way to permanently treat hiccups is to think about why they're happening in the first place. So that would be overall sympathetic hyperactivity and spasms of the diaphragm. And then think about, okay, how do we maximally depress sympathetic hyperactivity? So Dr. Huberman's method is the best way to temporarily and immediately stop hiccups, unless you roll around with needles in your pockets like I do, and then needling would be the best way. But as far as long-term results, dry needling combined with joint manipulation are the 2 best ways, the 2 most powerful ways that physical therapists have at their disposal. And I think they're 2 of the most powerful ways in all of medicine to depress sympathetic hyperactivity, right? So how does sympathetic hyperactivity happen? Well, it can happen from mental or physical stress, strain, or trauma. And that happens throughout our life. So as we get older, right, our sympathetic threshold or a sympathetic baseline becomes more and more sympathetically hyperactive. That's one of the reasons that people start to get erectile dysfunction, headaches, all sorts of weird stuff at mid-age. I think it's because our sympathetics have just been hyperactive for too long, and the fact that human beings have not lived over the age of 50 for more than like 70 years out of our whole history, right? So we don't have a lot of practice being over the age of 50. The age of 50 tends to be when we tend to get all sorts of problems. Hiccups can be one of those things, right? So how do we depress sympathetic hyperactivity as much as possible? Well, in general, if we're talking about needling and joint manipulation, what physical therapists can do, one of the easiest, most surefire ways to depress sympathetic hyperactivity is reduce as much tissue pathology throughout your body. So any little piece of tight tissue that's aggravating and sending negative afferent sympathetic signals to the brain, elevating sympathetics, and by specifically targeting the parasympathetic portion of the autonomic nervous system as strongly as we can, because we know that the sympathetic parasympathetic relationship is like a seesaw, right? So the more sympathetics go up, the more parasympathetics go down. The more parasympathetics go up, the more sympathetics go down. So the more the sympathetics are elevated, the more inhibited the sympathetics get. So if we can stimulate the sympathetics, which reciprocally inhibit if we can stimulate the parasympathetics, which reciprocally inhibits the sympathetics, while at the same time removing sympathetic hyperactivity from the entire body by removing pathologic soft tissue, we are directly addressing the overall underlying cause of hiccups, which is sympathetic hyperactivity, right? It's the best way to overall stop hiccups, and this concept should be used for all physical and mental impairments, right? I think it's crazy that mental impairments are not treated in conjunction with physical impairments, because there's some type of relationship that forms with our body when we get a mental problem and a physical problem. I see this all the time in the clinic. When you get to a certain part of a person's body and you treat it, they have a significant emotional release and then they feel much better afterwards. Exactly what's going on with this, nobody knows, but there's some type of brain-body connection. So we cannot treat any mental or physical impairment fully and maximum potential without also treating the opposite side. So the brain and the body have to be treated together. Same thing with hiccups, right? Hiccups can happen just from mental stress that causes you sympathetic hyperactivity that causes your diaphragm to start contracting. So just something to keep in mind. So as far as hiccups go, needle the parasympathetic dominant areas of the body. So that would be the vagus nerve distribution in the ear, the auricular branch of the vagus nerve, the subcranial and suboccipital spine because of the cranial nerves, right? Cranial nerves. Typically, the most parasympathetic one is the trigeminal nerve. The vagus nerve is the most parasympathetic dominant. We also have the trigeminal, the facial nerve, the hypoglossal nerve is sometimes referred to as parasympathetic. So the trigeminal nerve is the nerve itself does not have a whole lot of parasympathetic connection or activity, but the trigeminal cervical complex, the afferent section, the cephalic section of the complex in the brain has a lot of parasympathetic connections, right? So treating the scalene muscles for hiccups is very, very important because the scalenes are the closest muscles to the phrenic nerve, and there are some strands of the phrenic nerve that go through the middle and anterior scalenes, right? So if the scalenes get tight, they cross the anterior and the middle scalene, cross C3, 4, and 5. So if those muscles get tight, they contract, they compress the spinal nerves, they compress the phrenic nerve root exits. Aggravated nerves get hypoxic nerves spontaneously fire. That can cause diaphragm problems, breathing problems, and hiccups, right? So the scalenes, as far as direct effect on the phrenic nerve and musculature goes, the scalenes are probably the most direct because the phrenic nerve exits right in between the anterior and the middle scalene, and it has little strands that go through them. Again, if you want to think about the scalenes and the quadratus lumborum as two important muscles to treat together, because the scalenes attach the first rib to the cervical spine, the quadratus lumborum attaches the 12th rib to the lumbar spine, right? So they're kind of at opposite ends of the rib cage. So let's just say the QLs get tight first and they pull the whole rib cage down. Well, that's going to piss off the middle scalenes. It's going to pull the first rib down. The middle scalenes are going to get aggravated. They're going to get tight. We already have a depressed rib cage, so when the middle scalenes get aggravated and pull the first rib up, it's easier for the first rib to get deviated. Then you can start getting things like thoracic outlet syndrome in combination with hiccups, because the middle scalene can cause thoracic outlet syndrome and it can directly put pressure on the phrenic nerve, right? So the middle scalenes and the QLs are very good muscles to needle together. And then as far as other muscles go, we're going to needle the middle scalenes, the QLs, again, any other pathology in the body, but we're just focusing on the specific muscles that most directly cause sympathetic hyperactivity and hiccups, right? So middle scalenes, QL, and then the other two muscles are the psoas major and the multifidus, right? So the psoas major is the deepest muscle on the front of our spine. It's the closest muscle to the sympathetic chain. So if the psoas major gets tight, it's going to pull on the sympathetic chain. The sympathetic chain, when it gets pulled on, is going to stimulate sympathetic hyperactivity. That's going to stimulate the phrenic nerve. It's going to make the diaphragm more likely to fire and more likely for you to have hiccups, right? I think I kind of got sidetracked. So as far as the parasympathetic dominant places, right? Auricular branch of the vagus nerve in the ear, subcranial spine, and the sacral plexus and the pelvic floor, right? So the sacral plexus, S2 to S4, is parasympathetic dominant. It innervates all 9 pelvic floor muscles. So this is one of the very, very many reasons why I say needling the pelvic floor is vital if you're going to maximally improve anybody's health in a physical therapy setting, because even if somebody doesn't have pathology of the pelvic floor, which I would challenge you to find me somebody that has no pathology of their pelvic floor, even if it was perfect, needling the pelvic floor is still very important because they're innervated by S2 to S4 to some degree. So those 9 pelvic floor muscles, right, because they're innervated by S2 to S4, needling them stimulates the parasympathetics, because S2 to S4 is a parasympathetic dominant portion of the spine. So by needling the pelvic floor, the ears, the sacral plexus, and the upper cervical spine, we're specifically targeting parasympathetics. And then again, to target the muscles that can most directly cause hiccups, the middle scalene, the QLs, the psoas major, which sits right on the front side of the vertebral bodies, and sits right next to the sympathetic chain, and then the multifidus muscle, which is the deepest muscle on the back side of our spine. So the multifidus muscle sits where my fingers are on the back side of the spine and goes all the way down. And then if this was the lumbar spine, the psoas major would be sitting like that, right? So the psoas major and the multifidus in the lumbar spine at least make a sandwich out of the sympathetic chain. And then the multifidus is the deepest stabilizing in the back throughout the spine. So if that muscle gets aggravated, the multifidus, it gets infiltrated with adipose tissue and it totally shuts down. It reduces stability of our spine. Our spinal joints get deviated. The sympathetic chain gets pushed on. The stellate ganglion, which sits right at our first rib here, the star ganglion, right? That's like our sympathetic control center for our upper extremities. If the sympathetic chain gets pulled on, that ganglion is part of that chain. That ganglion starts to get pulled on. It sends negative afferents to our upper extremities. It sends negative afferents to the brain. It causes excessive activation of the trigeminal cervical complex. The overall result being excessive sympathetic hyperactivity. And if the impairment that you're presenting with is hiccups, the more hyperactive your sympathetics, the worse your hiccups are going to be. So again, the breathing technique Dr. Huberman talks about, 3 inhales in a row, is an excellent temporary stopper of hiccups, but you're turning on the part of the nervous system that's already the problem. The way it's working is you're just turning it on enough where it gets tired and it calms down a little bit, but that is not the best way to permanently resolve hiccups. The best way to permanently resolve hiccups is to treat the nervous system itself and the specific neuromuscular structures that could be causing hiccups, right? And then aside from the needling, you guys, it's very, very important to perform joint manipulation for hiccups. So if you can watch the thoracic outlet video, has some of this information in here, but the middle scalene attaches to C2. If C2 gets deviated, the C1-2 segment is the most mobile segment of our spine, right? So if that gets deviated, it's going to aggravate the trigeminal cervical complex and the trigeminal cervical nucleus, which sits in the dorsal horn of the spinal column at C2. So if the trigeminal cervical nucleus gets pissed, it stimulates the trigeminal cervical complex. The trigeminal cervical complex has a couple of connections with the periaqueductal gray and the locus ceruleus, right? So the locus ceruleus is our primary epinephrine producer. Epinephrine is a sympathetic neuromodulator. The more epinephrine we have, the more anxiety we have, the more stress we have, the more the sympathetics go up, the more cortisol we have, right? And it just leads to all sorts of detrimental results, one of them being hiccups, right? So by needling the muscles first to reduce muscular tension and normalize pathology in the muscles throughout the body and in the specific areas that may be causing hiccups, followed up by normalizing joint deviation throughout the entire spine and the extremities for that matter to neutral, right? So I usually start at the neck and work my way down. But any joint in the spine that gets deviated, the easiest place for our body to compensate is to counter-rotate C1-2 because that's the most mobile joint in our spine. So if C1-2 gets rotated, because the middle scalene attaches to C2 and the anterior scalene attaches to C3 and those both attach to the first rib, that's going to cause all sorts of problems for hiccups, right? So needle first, then manipulate. Use Dr. Huberman's breathing technique. You can check that out it's on one of his breathing podcasts. And then if you really want to permanently stop hiccups and improve overall health, needling to specifically reduce sympathetic hyperactivity, elevate parasympathetic activity, and induce autonomic nervous system homeostasis is going to help with every single mental and physical impairment out there. Thanks for watching, you guys. Remember, you can check us out at intricateartseminars.com, and you can find my contact information there. Let me know if anybody has any questions about anything. Thanks.